I'm Meenhard Herlyn. I'm a professor at the Wistar Institute, director of the Melanoma Research Center. The Wistar Institute is in Philadelphia within the campus of the University of Pennsylvania, and I'm also a member of the University of Pennsylvania. We are coming here for the second conference organized by, I think, in a wonderful setting. And we bring together all the researchers within Australia and a few also international researchers. It is actually my second visit. I was here 4 or 5 years ago, and it's beautiful to see the progress, and certainly it was stunning to see the new Perkins Institute, and congratulations, that's the building. Wonderful, beautifully crafted, and also in the details. It's really done for the researchers, for the clinicians, for the patients. It's a beautiful surrounding, and I think great discoveries will be made there. They have never been as exciting. When one compares it to perhaps 5 years ago or back 8 years ago, nothing in therapy was working. And all the researchers and clinicians were quite actually disappointed of all the misshapes that they had in progress. And then all of a sudden, from different angles, different directions, it's all now coming together. And it's one big worldwide community, and they're all pulling together for the same goal. So in the last 2 years, 2.5 years, we had in the US 3 new drugs approved. This year 2 new drugs and a third one as well coming. So it's a total of 6 new drugs, and we expect that within the next 12 months we will have an additional 3 drugs approved, and there are several more in the pipeline. So it is an unbelievable coming together of fortunate circumstances where the industry, the pharma industry, and academic institutions closely work together to make this happen. I have to say that several of the initial clinical trials that led to approval in the US were done here in Australia. Australian clinical oncologists is at the front, as one of the front runners in the world. So their progress, the way they organize it, the way they organize the clinical trials, they have access to the patients, how they can introduce new drugs, it's exemplary for other countries. It's really wonderful. Then, I am not an expert in all the regulatory hurdles, but I believe if a drug is approved in the US, at that time or very soon after, it will also be approved in Australia.